morning, everyone. My name is Ákos Mátrai, and I would like to hold my 15 months progress report of my PhD work at the Center of Translational Medicine. I work as a specialist at the Department of Obstetrics and Gynecology at the Semmelweis University. My vision is to provide the optimal pregnancy care that contributes to the birth of healthy fetuses, and my mission with my PhD work is to highlight the risk of infectious disease during pregnancy. I would like to show you a quick overview about my two ongoing projects in which we examine the effects of influenza in the first trimester of the pregnancy. Let's begin with the first project. The title is "The First Trimester Influenza Infection Increases the Odds of Non-Chromosomal Birth Defects." It's a systematic review and a meta-analysis. A few words about the background. Influenza is a very common infection. There are around 50 million illnesses worldwide. And according to Central of Statistical Office, we have 400,000 cases in every year in Hungary. We know that the birth prevalence of congenital malformations can be estimated 3 to 5%, and these disorders underlie around 25% of perinatal mortality. Our aim is to assess the effects of maternal influenza infection during pregnancy on birth defects. Our clinical question is, does influenza increase the number of congenital malformations during pregnancy? We investigated the presence and the absence of influenza in the first trimester, and the outcome of the study are non-chromosomal birth defects. Our hypothesis is that influenza occurring in the first trimester increases the risk of congenital abnormalities. We made the systematic search in 3 databases, and after that we made the selection process, what you can see on the slide. On the next slide, I would like to show you the main results of the meta-analysis. The first outcome are oral clefts. Orofacial clefts are common birth defect with an estimated worldwide incidence 1.7 per 1,000 live-born worldwide. Babies born with these type of anomalies have feeding difficulties, speech problems, and conductive hearing loss. The association between first trimester maternal influenza infection and cleft lip and palate was reported in 4 articles. The heterogeneity was quite low, and overall results show that almost 2.5-fold increase in the development of cleft lip and palate. The next forest plot is about neural tube defects. Neural tube defects are birth defects of the spine, spinal cord, and the brain, and they happen in the first months of the pregnancy, even before the woman even knows that she is pregnant. On the slide, you can see we investigated 4 studies. The heterogeneity was 0, and after the statistical analysis, we got that the odds of having neural tube defects is 2.4 times higher in the influenza-infected pregnant group than in the control group. The results are significant. On the next slide, the next outcome are the congenital heart defects. We investigated 3 studies. The heterogeneity was also 0. Congenital heart disease has been the most prevalent birth defect, and it's remained to be an important cause of neonatal and infant deaths. After the analysis, we got that based on our results, this birth defect was associated with an increased odds for developing all types of congenital heart defects. Let's see the strengths and the limitations. Among the strengths, we had to mention our rigorous methodology, and this is the first meta-analysis providing, which is focusing on the first trimester, and among the limitations we have to mention that the influenza definition were based on symptoms, and the most cases were self-reported influenza infections. After the analysis, we can conclude that the influenza in the first trimester increases the risk of non-chromosomal birth defects. Implication for practice. If flu is presented in the critical period, we should make effort to prevent flu, and we should vaccinate against flu. Implication for research is to develop and maintain the detailed and comprehensive database about congenital abnormalities and pregnancies. We submitted our manuscript on 11th of October. During the review process, they requested rerun the search, some correction of the introduction, and some other minor correction. We answered them and resubmitted our paper in November, and they accepted it, and it has been published on 2nd of December in the Journal of MDPI Viruses. After the first project, move on to the second ongoing registry analysis, which is the investigation of the effects of maternal influenza during pregnancy on birth defect in the Hungarian population between 1980 and 2009. As I mentioned before, flu is a really common infection disease that occurs during epidemic outbreaks between December and March, and the non-chromosomal birth defects are 4.5% of the live births in Hungary, and they cause 25% of perinatal mortality. Our aim with this registry analysis is to assess the effects of maternal influenza during pregnancy on birth defect in the Hungarian population between this time. Our clinical question, our PO, and our hypothesis are the same, what I mentioned at the meta-analysis. A few words about the database. This database is the Hungarian Case Control Surveillance of Congenital Abnormalities. It is unique in the world. It was established in 1980, and it contains data about 90,000 pregnancies. On the next slide, I would like to present a quick look to the most important data which we got after the analysis. First, we verified that influenza occurring in the first trimester is a risk factor for congenital abnormalities. After, we examined what kind of birth defect can develop if flu presented in the first trimester. These are the most frequent disease, and we divided them in 3 big groups. These groups are congenital heart disease, neural tube defects, and the cleft lip and palate. After the statistical analysis, we got that the odds of having neural tube defects is 2.2 times higher in the influenza-infected group than in the control group. First trimester maternal influenza was associated with an increased odds of developing oral clefts, and based on our results, they showed that the first trimester maternal influenza infection was associated with an increased odds with congenital heart defects. With this topic, we are also in the preparation of the article period. The plan is to finish it in this month, in December, and submit it in January. At the end of the presentation, again, a quick look about two ongoing projects. And at the end of the presentation, I would like to close it with a quote from Steve Jobs. Sometimes when you innovate, you make mistakes. It's the best to admit them quickly and get on with improving your other innovations. Thank you for your attention.
Congratulations, Ákos. We have talked about specificity before of certain variables. And concerning your second project, you got a huge cohort, really good quality data. So how can you rule out, or how was your statistical approach towards certain malformations? And how could you rule out other influential factors? Was it possible to rule out, for example, with a multivariable analysis, the others, to the, for example, the most specifically sought?
We used multivariate logistic regression model for the statistical analysis.
Based on this, could you rule out other parameters? For example, as a urologist, I know that folate deficiency can result in neural tube defects, or so how could you rule out those parameters next to fluid?
If we would like to examine the drugs, how it affects the development, this will be the second step. First, we just examine the disease for it, and with this multivariate logistic regression model, we have seen smoking, alcohol, and education also.
Thank you very much. Congratulations.
Thank you.
Nowadays, we know that, so the conclusion is that influenza actually may influence congenital birth defects, the ratio of the proportion of congenital malformations. However, now what we see, and of course people should vaccinate, however, what we see is that the willingness of getting vaccines is really low, and I'm just wondering what public health policies can we make out of this conclusion of yours, that how can we convince young mother candidates that they should receive not only this vaccine but maybe also other kind of those viruses which may cause fever, because as we discussed previously, fever is the main reason behind or maybe the reason behind this conclusion. Actually, based on this, we can say that maybe for all kind of future pandemics and everything, we should protect ourselves.
Yes, thank you for your question. But yeah, we have to publish some kind of papers, and we have to hold a presentation about it, and we should make effort to prevent this kind of disease and vaccinate against these infections.
Did you have the opportunity to assess the different virus strains regarding their effect? No. And are there any differences over the time of the birth defects?
No.
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 So didn't see anything which would be specific for a dominant strain?
No.
For
no.
Okay. Thank you.
Thank you very much.